I like to do hormone testing with women that can't lose weight and have problems. I like to do thyroid testing. Oftentimes, people with sluggish thyroid or hypothyroidism, they start having dry skin, they start gaining weight. A lot of times they get more weight around the middle, and that's the same as with your estrogens too. A lot of times with your high estrogens, that weight around the middle that you can't get off. And the thing is, the thyroid is something that we can test fairly accurately. I was just reading last night that in the world, in regards to iodine, which is needed for the thyroid health, that 72% of the world population is deficient in iodine now. And so that's 72%, that's pretty high. And what's happened is that in thyroid, there's bromides in different things, like a lot of times these inhalers for asthma inhalers have bromide in it. So bromide replaces the iodine, and then the iodine is excreted out through the kidneys. So we replace, because of all the bromides that we're taking in through medications, we're then becoming deficient in iodine. The same thing with fluoride. Fluoride's been great at saving teeth and helping teeth, and it's in all our water, but it's at -1 valence too. So we build up all this fluoride. Well, it replaces the iodine. The iodine goes excreted from the body. So we're being iatrogenic in a way, or causing our own problems for all the people becoming hypothyroid now. We need to understand how important iodine is in the things that support thyroid health. For example, you need some zinc and copper every day in your to function well. You got to have that right zinc copper ratio. So a lot of people, I was just thinking, we're having all this, companies have copper, and everybody's wearing copper on their wrist and here and there, and then we're developing all this low testosterone with people. And zinc is really needed in order to make testosterone. So we have people that are low in zinc that therefore are low in testosterone. So instead of, when I have a man with testosterone or even a woman with low testosterone, I try to think about, well, what is their zinc level? So I have an amino acid survey. I have some testing I can do through blood testing by SpectraCell to check the minerals in a person's body, to check their zinc, to check their copper, check their manganese or magnesium, and those kind of things can help me to cure people. Say, if we can get the thyroid healthy, then they're going to be able to lose weight. The same way, if we get in the testosterone's low, if I can find out why their testosterone's low, it'd be better to fix it than just give them testosterone. A lot of times, even as a man, as a doctor, I didn't know I had estrogen and progesterone in my body, but I have all those things, and they need to be in balance for me to have good health, heart health and bone health and things like that, which estrogen and progesterone provide. The same way with women. Women make testosterone, and they need to have a certain amount of testosterone to have, say, libido, to have good skin. Testosterone is really needed in regards to wrinkles and thickness of the skin health, into making strong muscles, having bones, and making your red blood cell production is important, and you need testosterone to do that. So I have, like two ladies today had too high testosterone, I feel, but on the other side, there's a lot of ladies that have too low of testosterone, and that's why they get it in creams and things by doctors. And most of it is built around helping with their libido. But on the other hand, it helps memory. It can help their muscle strength. It can help their fatigue. It can help their mood and depression. So Again, then we get back to testosterone, real low testosterone. You might have an increased problem losing weight because, as you know, a lot in men is when men take testosterone injections, it converts, most of that goes to muscle. You start losing weight and burning fat more. So the same thing can happen in women too. So these things it's like a puzzle of putting together why a person doesn't lose weight. So we got the hormone balance is really important, which you can do by the blood, the saliva, as I said, and then they've come out with a urine testing that I really like because it gives you the metabolites of your estrogens and progesterone. And there's some bad estrogens, metabolites that you don't want your estrogens to be metabolized into, and that's the 16-hydroxy estrogens and then the 4-hydroxy estrogens. Both of those are known to cause cancer. So if I do my testing and I find a high 16-hydroxy metabolite and a high 4-hydroxy metabolite, then there's some things that I can do to help them to have better estrogen metabolism to get back to what we call the 2-hydroxy metabolite, which you don't have the increased risk of cancer in the studies like you do on the 4-hydroxy and the 16-hydroxy. So it's interesting. The tests are available. A lot of these things have been around. We have to, at this time, it seems like most of us have to pay out of pocket to get these testing done. They're getting less expensive and less costly now because we're having more people becoming educated. And hopefully the insurance companies will become more educated, because wouldn't it be better to stop cancer or pick up cancer in its early stages or the risk signs than to have somebody have cancer, go through all the surgeries, the cost of surgeries, the cost of chemotherapy, the debilitation of the disease. So I think more from a preventative side and well as a diagnostic side, and then catching the disease earlier. And that's what kind of anti-aging and regenerative medicine is all about, is trying to prevent as well as treat in a healthy manner with some appropriate knowledge of how to help people get better.